Hi, I'm Dr. Elston, and today we're going to talk about unexpected things that you might encounter from your lipedema surgery. So today I wanted to sit and take a few minutes and have all of our staff kind of go over the unique perspectives that they may have and the things that they deal with our patients that aren't expected after surgery. There's a big lead up to it, usually many months in terms of scheduling and preparing and getting insurance approvals, but you unfortunately can't prepare for everything. So this video is an attempt to help you prepare for the unexpected things.
A lot of patients think that when they get into the procedure room, they're going to just kind of sit around and let us do our thing and, eyes straight forward and wait for it all to be over. But you're actually kind of involved in the procedure. So we want you to let us know how you're feeling, and we're always trying to let you know what we're going to do so there's no surprises anywhere. So a lot of people think, you can't say anything or you can't move and adjust a little bit. And you're right there, you don't want to be jumping around, but if you're feeling uncomfortable, you can let us know, let Dr. Elston know, and we can let you kind of move a little bit and shift so you're comfy. You'll be kind of chatting with us. If something feels weird or if it hurts, you can let us know. We'll add some more numbing, or we can move to a different area, things like that. Sometimes Dr. Elston wants to know how a certain thing is feeling so he can know he's in the right area. It's not a hands-off procedure for the patients. You're involved. We want you to tell us what's going on with you so we can stay aware of how you're feeling. A lot of people think that right after surgery is over, they're gonna wanna go get some food somewhere. You'll have been here for a few hours and you'll think you'll be hungry, and you will be, but you're not gonna wanna sit at a restaurant. The reason for that is that you're gonna be draining some of the numbing fluid, because we, have to numb up a large area, so there's gonna be a lot of fluid in there, and a lot of it gets sucked out during the liposuction portion of the procedure, but some of it will be draining over the next couple of days. So you don't wanna be out at a restaurant. You're definitely gonna wanna order some Uber Eats, or maybe hit the drive-thru, or have something ready for pickup, but you don't run in and grab it.
Some people think that they only have to be in compression for right after surgery, but you actually have to be in compression garment for at least 2 weeks, and that's non-negotiable. And then to give yourself basically the best chance for your healing and for your recovery, it's best to wear it as much as you can tolerate. So if you're wearing compression garment, it feels like a nice hug, feels like some very firm pressure on your body, but helps get the blood moving, helps you stay less swollen. If you're not wearing compression, you run the risk of swelling. It'll make you not heal as well, it'll make you not move as well, so it's best to just wear your compression garment so everything smooths out over time. So if you don't wear your compression garment, which we really want you to, Dr. Elston will yell at you and also smack you on the wrist. Or me or Jackie.
I think the thing that catches patients off guard is they are not able to do as much activity after their surgery. We do ask that they only walk about 5 to 7 minutes after for the first 2 weeks, and then after a month they can do some light workouts, lightweight, so nothing like a 20-pound dumbbell, nothing like a 15 dumbbell. We really want to keep you light and minimal and focus on your recovery and resting. We ask that patients only walk 5 to 7 minutes every hour because we don't want you to overdo the exercise and you can create the potential for having a seroma. It will take about 2 weeks to really focus on getting that rest. So we would love for you to rest and put your feet up or your arms, whatever it is that we're addressing, and doing some elevation. We ask that you do pumps of your feet, of your hands to get that blood flowing, and then after an hour, hour and a half of sitting down and getting some rest, we do ask that you get up and move for about 5 to 7 minutes every hour. Patients are really shocked that they do need about 2 weeks of rest after their surgery. If you work from home, depending on your surgery, 1 week for sure you're gonna be resting, and then the second week you could do some light work. Most people just work half a day. It's not something that you can just bounce back and get back into the office the following day or jump back onto your laptop and pick up on meetings. We really do want you to focus on your healing process. I mean, you just had some medications, so you're a little drowsy, you're tired, you may not be thinking as clearly. Because you're gonna be wanting to work on your laptop, you're most likely gonna be sitting in a position for too long and not acknowledge that you're needing to get up and do some ankle pumps or elevate. So it's a slew of things. You're gonna cause more swelling in your feet or in your arms, and you're just not gonna acknowledge the time because you're so busy working.
One thing is having a support person. So some people think that they only need a support person just the day of surgery and that's it. It's really important to have that support, to be with you at home for after, preferably 24, 48 hours and even longer if possible, depending on the areas that you do. It just helps with the healing process emotionally, cuts down on that anxiety, and helps with daily tasks, dressing, showering. They keep you on track with your medications, making sure you're following the post-operative instructions, which is really important, and anything else, that you may need, cooking, dressing, like I said, showering. One person didn't have a support person. They thought that they only needed it for a day or two. They started doing daily tasks with their kids, and they ended up having a little bit of complications after, but was able to be resolved afterwards. But you can't have a good outcome if you don't have that support person with you assisting you. They don't need to take the full amount of time that you're taking off as far as having the surgery done, but it is good for them to at least try to be there for the first week at least. You may feel like you can do everything by yourself, but really you can't. You should have that support person assisting you if possible. So then that way you do get good results.
I see patients that have problems in the first couple hours after surgery, the first week or so after surgery, and then maybe months after surgery. So I think that the thing that's going to catch people off guard in the first 24 to 48 hours is this sheer volume of drainage. So we inject a lot of fluid into the area that we're working on, and that fluid gets the patients numb, but then it also gets partially suctioned out. Some of it will then find its way out through the little tiny poke holes that we use for access incisions. So over the first 24 to 48 hours, patients will find that there is a lot of drainage. We've got compression garments on, we've got wraps on you, but still, like, most patients are very shocked by how much fluid is coming out of them. That fluid is kind of like Kool-Aid or Hawaiian Punch colored. It's a little bit mixed with your own blood because you had surgery, but most of it is the fluid that's draining out from the swelling and also from the fluid that we injected in. But if you're non-medical and you've never dealt with anything like this before, you've never had liposuction, it can be a shocking amount of drainage. So we usually encourage patients to really aggressively hydrate in the first 24 to 48 hours to anticipate those fluid losses. But I think mentally, you also need to prepare for seeing a lot of stuff come out of your body that you've never seen before. After the first stage of recovery, when people are kind of done with the draining and the pain starts to abate, I think the thing that catches patients off guard in the 7 to 10 day window is that they will just get kind of bluesy and depressed. A lot of it is almost like a buyer's remorse kind of thing because they get really amped up and excited for the surgery, and it's like, really adrenaline inducing because you're finally getting this thing to make you feel better. And then you go through the pain of surgery and that's anticipated. But then in that 7 to 10 days after, you don't really have pain so much anymore, but the body part where we operated on just doesn't really keep up. So it's still kind of swollen, it's kind of bruised, it's a little bit achy, but you just feel very limited in what you're going to do. And psychologically, after like 7 to 10 days of surgery, you want to be recovered. You want to kind of start getting back to life. You're thinking about transitioning back to work or taking care of your kids, and people get caught off guard when they are still kind of not 100%. From my standpoint, it's totally normal. You had a major surgery, you shouldn't be fully recovered at 7 to 10 days, but patients will get a little bit depressed because they want to get back into doing things. They're kind of done watching Netflix, they're done sitting on the couch for a week, and they really want to get back into things, and your body just can't keep up yet. And it's normal. The first 2 weeks are kind of a wash. You don't really get a whole lot of activity. You're walking small amounts, you're doing, small cleaning or small cooking around the house, but you just need to be prepared for just not feeling 100% and your body not keeping up with you. Everyone's got their plan for the first few days after surgery, and then no one really anticipates needing that plan past like 4 or 5 days. So then you kind of like you've been a couch potato, you've dealt with the drainage, and it's hard. No one likes to sit around for like 7 to 10 days, and you got to find things to kind of keep your mind occupied. But when your body just doesn't keep up, it can be really frustrating. The long-term thing that patients have a hard time expecting or anticipating after surgery is that there will still be some degree of swelling for the first 6 to 9 months, call it. Some areas like the thighs, it may even take like a full 12 to 18 months to get the final results. I usually explain to patients that a month out, things look better than when you started surgery, but they're still nowhere near perfect. At 2 months out, most patients are usually pretty happy, and at 3 months, they're thrilled. But even at 3 months, things are still a little puffy, the tissue will feel a little bit squishy. You might start getting swollen, if you take a flight or something like that, or if you have a long day of walking, you get more swollen at the end of the day. That can be kind of frustrating because, again, you're like 3 months out. You feel like you should be recovered, but the body just takes time. You've gotten new lymphatic channels that are established at that point, but your body is by no means healed. There's still scar tissue that's softening up. There's swelling that's going down. There's new lymphatics that are knitting themselves into place. And it can be a little bit frustrating because you want to see the full results. Everything looks better than before you started, but it's hard to imagine something taking a full 9 months to get fixed. So I think that some patients will struggle with that they want to be better, they want everything to be fully healed, but you just can't rush time. You can't rush the body speeding up any more quickly. And I think that people want to be active in their recovery, and this is one of those things where you just got to kind of sit on your hands and let it happen on its own. I think it's challenging to give patients a really firm expectation of what's going to happen with surgery. With lipedema, it affects different areas of the body. Some patients that may look similar on paper or in photos, they have very different sets of symptoms. And even though the surgery itself may be the same in terms of technique or how much volume you remove, those patients may have very different outcomes because they have different expectations. We'll see some patients, not so many, but some of them are more focused on the cosmetic aspects of it. That patient is probably not going to be as happy as the patient who has a hard time walking, constantly lives in pain. Because if you can relieve the pain, that's great. You've changed someone's life every day. It's much harder to change someone's perception of themselves. So I can think that someone's legs look fantastic and I did a perfect surgical result, but I don't have to live with their legs. So I think it can be challenging when you have someone that's more cosmetically focused, because I can't really change how they see themselves in a mirror. Even if I physically change their shape, that may not change their psychological perception of themselves. So that can be challenging, and I do tend to try to, under-promise, over-perform on that. But it's medicine's like this. It's really challenging. Nothing's 100%. So you definitely don't want to oversell someone on something. They go through all these surgeries and they're like, this is not what I expected. That's a failure on my part, and it's a lack of judgment. It's great when you have someone that's like, wow, you really told me this wasn't going to be so good, and I'm thrilled with it. That makes me really happy. But at the same time, you kind of wish that you could give people that enthusiasm and an excitement early on so that they can kind of share in that with you. But you definitely don't want to mislead people or oversell them or overpromise them something, because then if they're frustrated on the back end, that's on me. Even if I did a perfect surgery, if I promise them unrealistic outcomes, it's not really a great job as a surgeon or a doctor.